Everyone, Courtney here. Today I'm going to talk to you about EDS hypermobility type, which is the type that I have. So for the past couple of videos you've seen this week, you've heard some information and you've seen lots of demonstrations, finger bending and body bending and whatnot. I'm not going to go that route just because how many times do you want to see someone bend their finger? I know it's cool, but I'm going to go down the more factual route. This time last year, I decided to take an online class to kill some time, and I ended up writing a paper about EDS, so I have lots of information, and everything that I will be saying in today's video has either come from my paper or sources that I found, so they're all factual. I'm not making any of this up. So everything I'm saying is factual and from personal experience. So let's get right into it. To start, hypermobility type is the most common type. It is found approximately 1 in 5,000 people. It can be called benign because there is no skin fragility or abnormal scarring. It is commonly associated with joint dislocations. It is the least, I put least in quotes, severe form, but there are musculoskeletal complications. So to get to the whole genetic side, we've heard this talked about before, but I'm going to say it again. EDS hypermobility type is what's known as autosomal dominant, which means that there only has to be one affected individual, and that individual has a 50% chance of passing it on to their offspring. So in my case, my mother has it, and I'm an only child, so it looks like I won the luck of the draw in that case. It can take some time, as you probably will know, for people to get diagnosed. People can get diagnosed anywhere from birth to adulthood. For females, it can take up to 21 years, and for men, it can take up to 15. And Kayla spoke about this, and I think Sarah might have too, in their videos about the Beighton scale. So I'm not gonna demonstrate just because I really don't feel like getting up. I'm really comfortable sitting where I am. But just go through so you know what each one of the criterion are. So from the Beighton scale, each joint is worth a point, and you get a number out of 9 as your score. The first criteria is thumb to forearm, which I will demonstrate at least one for you. Number 2 is extension of the little finger greater than 90 degrees. The next is hyperextension of the elbow. Number 4 is hyperextension of the knees. And number 5 is standing with your legs straight and palm to the floor. And there are some other criterion as well. I'm just getting my book here to reference. I'm using Dr. Tinkle's book right here that I talked about in a past video. Here it says, the hypermobility syndrome is diagnosed in the presence of 2 major criteria or 1 major and 2 minor criteria. So besides just the Beighton scale, there are other things that can be considered as well, such as under major criteria, aside from the Beighton scale, having pain for longer than 3 months or 4 or more joints, which is one of the things that my doctor mentioned to me that helped lead her in her diagnosis of EDS for me. Other things for minor criteria are extended pain in joints, dislocations or subluxations of more than 1 joint, varicose veins, hernias, some abnormal skin. So there's more than just the Beighton scale to be considered when you're looking to get diagnosed with EDS. EDS hypermobility type does affect the entire body as well, and I'm going to touch on that a little bit too. So that which brings me, it was just something I was thinking about earlier today, that I'll tell people I have this and they're like, oh, you have bendy joints, that must be so much fun. And I'm like, did you not just understand what I was saying? My joints are in pain all the time. They could slip out at a moment's notice. I don't think people really get it. This is really painful disease. It's not, yes, it is fun to have these party tricks, I guess, but it does affect the entire body as well. So it's not just the fact that, ooh, I can bend my finger backwards, look how cool I am. It's an entire body disease. So I'm going to touch on that a little bit as well. So for pain, the pain can manifest itself in different types. There's joint pain, limb pain, back pain, muscle, abdominal, thoracic, and even headaches and migraines. And pain, as we will know, for us is chronic, which can also lead to anxiety and depression in some people. I know for me, I get anxiety when I go out in public because I'm afraid that someone's going to bump into me or something and cause me to have pain. There was one time when I was out grocery shopping and a woman wasn't paying attention and she backed into our shopping cart, and I was the one, driving the cart, and it hit me right in the chest and caused me a costo flare-up for a while. It was not a good idea to just hit myself in the chest right now either. To move on, we know that the classical type is mainly the one with the skin manifestations, but EDS hypermobility type can have some as well, such as soft, velvety skin or a mildly stretchy and hyperextensible, though those aren't major criteria. EDS can affect other body systems as well. I could go through everything. The book that I've been referencing goes down and breaks down each body system and how it affects it. So I just picked some of the major ones to go over, such as to start with the lovely bowel system. People with EDS can often have functional bowel disorders such as gastritis, IBD, celiac disease, GERD, and even gastroparesis. For musculoskeletal, which is the main component of hypermobility type, the shoulder and the knee are the most commonly dislocated joints. The chest and the ribs are affected, such as costochondritis. It can affect the spine, the hips, the ankle, the jaw, as well as specifically TMJ. And some people with EDS, especially if it's in babies, have hypotonia or low muscle tone. So even I strongly think that if you are able to exercise, you should, safely of course, just to help strengthen the muscles around the joints and just try and help things out a little bit. We can move on to the cardiovascular system. Two big problems with the cardiovascular system in EDS hypermobility type. I've been saying that a lot and it's getting really difficult to say. But two main problems can be mitral valve prolapse and aortic root dilation. And I have a really great cardiologist. Yes, I have been seeing a cardiologist even before my EDS diagnosis because of some family history. And when he found out that my mom and I both have EDS, we both actually had an appointment on the same day, and little did he know that he was going to get 2 EDS patients in one go. My doctor wanted to be very thorough and check us out for all these problems, so we both had repeat EEGs, and it had been a couple years since our last one. And then we also had an MRA, which was pretty much an MRI, and then we had some sort of dye injected into us. I don't quite remember. I just remember it left a really funny taste in my mouth, and I was in there for a while. But basically, long story short, everything came back clean. We don't have any heart problems, so yay for my mom and I. But the cardiovascular problems can also lead to the dysautonomia, which all of us on this team, I believe, are affected in one way or another. And we are going to dedicate an entire week just to talking about dysautonomia and all the things and whatnot. But as we probably mentioned before, dysautonomia, umbrella term, some terms underneath are POTS, orthostatic intolerance, which I've been dealing with. Dysautonomia and POTS can lead to chronic fatigue, and migraines are also a symptom or a part of dysautonomia as well. So those are some of the main body system parts of the body that hypermobility type can affect, and there are some things in my other category that I have written down that I'm just going to go through really quickly. The first being hormones and joint laxity. I'm sure that some ladies can attest to the fact that during our time of the month, we tend to feel worse. I call it that I feel more bendy than usual. The next I have are anesthesia problems. There are 2 parts to this. One being, I think, when you get a tube put down your throat, you have to be careful with the jaw. And the other being that connective tissue is found collagen, 80% of the body, our cellular matrix. I'm going to geek out right now again. The connective tissues make up the substances between our cells, and basically I think because it's looser than most, the analgesic effect, which is the part when you're under, is less, so you have to be careful about being medicated. You might come out of your anesthesia sooner. Next, just eye problems, breathing problems, and problems with chewing and swallowing as well, because the muscles in our throat are a bit lax. It's hard to support our neck and then just to get the muscles to swallow as well. And then one thing that I know we talked about and we all get is there a treatment? Is there a cure? How do you care for this? And as we've said before, there is no treatment currently. The gene in question is still being looked for. And I found, once again, going back to the book here, a really nice quote that I think sums up EDS really well. It says here, although many EDSers have a lot in common, each one is unique. The person, not the disorder, should be treated. And then at the bottom it says, no 2 zebras are alike. And I think this sums up EDS in a complete zebra stripe nutshell. It means there are textbook definitions, but none of us fit it perfectly. I mean, some of us are more hypermobile than others, and some joints are more affected than others. We're not exact carbon copies of EDSers. So you have to treat each person's symptoms differently in order to effectively treat the disease as best you can. One being pain medication tailored to that person's specific pain, whether it's how much or the type of pain or the type of joint pain it is. Next, I have physical therapy and surgery. Physical therapy can help just strengthen muscles or even help recuperate after surgery. Some people might need surgery to help get a joint that's permanently dislocated to go back into place. And as I mentioned before, exercise. If you are able to exercise, low resistance exercise is best. But whatever exercise you do decide to do, if you do, just please be careful. Know your limits. Don't push yourself. We don't want to hurt ourselves more than we already are. And then lastly, bracing and splinting. Never brace more than you have to. You don't want to weaken your muscles. I have 2 braces. They're stuck together. It's fabulous. The first being my knee brace. I am no stranger to knee braces. I picked this one up at a Walgreens, so it wasn't too expensive. Typical one-size-fits-all kind of deal. I only use my ankle brace when absolutely necessary. If I can get away with an ace bandage, I like to, just because you don't want to overbrace and effectively weaken your muscles. So I hope you found that helpful and informative. Leave me any questions or comments below on my Tumblr, through email, through Twitter, anything, any way you want. Just ask me questions so I can have a good video for you next week. I think we're almost at 50 followers, which is pretty fantastic. So that's just kind of mind-boggling me that 50 of you have decided to tune in and watch us every week, which is fantastic. I hope you have a great weekend. Give the video a thumbs up for my new haircut. No, just kidding. Just give it a thumbs up. Subscribe. Share this video on all your social media. We want to get the word out there. So share, share, share. Like, subscribe. I hope you have a great weekend. I hope the weather is nice where you are. And I will see you next week for my Q&A video. Bye, guys.